To determine unknown concentration, we plot absorbance versus concentration and then use Microsoft Excel to generate calibration curve. Then we obtain linear equation by using the Euler vector and then we determine the unknown concentration. Next is for SEM analysis procedure. For SEM sample preparation, first we crush tablets into fine powder and then we attach conductive carbon tape to aluminum stub. Then we place powder on carbon tape. We spread sample evenly. Then we remove excess powder. For the imaging procedure, we insert sample into SEM chamber, then achieve vacuum condition. Perform imaging using suitable parameters, then we observe morphology and surface texture and examine crystal structure and agglomeration. These are the magnification that we use to detect and analyze the morphology of aspirin and loratadine.
From the UV-based analysis of aspirin, we have determined the absorbance range between 0.0853 to 0.0959. The trend of the curve shows that the absorbance increased as the concentration increased. The positive linear slope shows the relationship between absorbance and concentration is directly proportional. The unknown concentration of sample was determined by using the equation y equals to 0.0013x plus 0.083, where y is the absorbance and x is the concentration. For loratadine, the absorbance range was obtained between 0.0863 to 0.0924. The overall trend was similar to aspirin, where the trend shows positive slope, proving the absorbance is directly proportional to concentration. The concentration was determined by using the linear equation of y equals to 0.0008x plus 0.0845. The overall result is valid as they all obey the Beer-Lambert's law.
Aspirin was observed at 5,000 times magnification under SEM. The particle appear as irregular and heteroglobules with size ranging from 1 to 20 micrometers. The sample shows a clearly crystalline appearance, and in terms of surface texture, the particle have a rough and layered surface with porous aggregate. This morphology is consistent with typical direct compression or wet granulated aspirin tablet viewed at high magnification, where the active pharmaceutical ingredient retain its crystalline character but mechanically deformed during manufacture. Then, loratadine is observed at magnification of 20,000 and 40,000 times under SEM. The particle exhibits irregular flake structure, but mostly it is round to sub-rounded and rod-like shape observed. The particle size range from approximately 0.1 to 2 micrometers. The surface texture appear relatively smooth with slight porous characteristic. In terms of crystallinity, the sample demonstrates a mixed crystalline appearance. Thus, the image mesh well with typical loratadine powder morphology. This slide shows a comparison between the pure drug and their pharmaceutical tablet form under SEM analysis. For aspirin, pure aspirin crystal appear a rod and spike-like structure with smooth and well-defined surface, having a size range of 5 to 20 micrometers. In contrast, the pharmaceutical aspirin tablet shows spherical and anhedral shape. The particles are rough, have layered surface, and form porous aggregate. Its particle size is slightly smaller, ranging from 1 to 20 micrometers. For loratadine, both pure loratadine and the pharmaceutical loratadine tablet exhibit similar rod and needle-like morphology. They are both less crystalline in nature. However, we can see a clear difference in particle size. Pure loratadine ranges from 1 to 10 micrometers, while the pharmaceutical version is much finer, between 0.1 to 2 micrometers. Both maintain a relatively smooth surface with little porosity. In summary, aspirin shows noticeable morphological changes after formulation, while loratadine retains a more similar morphology between its pure and tablet form.